This is Dr. Krishna Raj Ganesh Narayan, a periodontist by profession. When patients lose teeth, they always have a question: what is the best way to replace a missing tooth? Right? A missing tooth can be replaced by a removable denture or by a fixed denture. The removable denture gives you only about 10 to 20% of natural function. Whereas a fixed denture, you have two options. You have something called as a bridge and you have something called as dental implants. Dental implants are nothing but titanium posts that are placed inside your bone. And once they go inside the bone, they act as a root of that particular tooth, so that we can use that root as a foundation and then give you a crown or a cap that will replace a missing tooth. Now, mind you that when you go in for a dental implant, it gives you close to about 70% of natural tooth function. Nothing can replace a permanent tooth or a natural tooth to its 100%. But the closest thing that can come to replace a missing natural tooth is a dental implant. Many times patients ask me this question that you have two options, right? I can either go for a bridge or a dental implant. A dental implant is a little more expensive, but bridge is comparatively a little more economical. So why go for a dental implant, or what dental implant gives you an advantage over a bridge? Now, normally when you go in for a bridge, what does it mean? When you have a missing tooth, you have to take support, right? You have to take support from a tooth in front and a tooth at the back. So normally, like a bridge, you have two poles to either side. So we call these as abutment teeth. Now, in order for us to give you a bridge, we will have to cut your adjacent teeth, right? And so you're making a good natural tooth weaker by cutting them. Secondly, when you give you a bridge, it gives you the cap part, but it does not give you the root. So the load of this particular tooth is borne by the adjacent two teeth. So over a period of time, you're not only making them weak by cutting them, but you're also increasing the load on these two teeth. And finally, a dental implant is basically a natural root. It's like a root. Why are roots necessary? So when you have a tooth, natural tooth, you have a root and you have a crown. A root is necessary so that the forces of chewing go to your bone through the help of this root. So when you go in for a dental implant, you get something like a natural tooth which helps in transmitting these forces to your underlying bone, which bridge does not give you. So these are the advantages of a dental implant over a conventional bridge. So it's much lighter. It does not involve cutting of your adjacent teeth. It gives you a root which mimics the natural structure of a natural tooth. A common question that I keep getting asked by: my mother is already old, or I'm already 60 years old or 70 years old. Is it safe? Are dental implants safe for me considering my age and my other physical frail condition? Now, let me tell you, we have placed implants for people who are even 82 or 83 years of age. So age is not by per se a restriction for placement of dental implants. What does make a difference is the amount of available bone that is present. So once the tooth is gone, and the longer that you wait for replacing the natural tooth with an implant, the weaker your bone starts getting. So if you wait for a long period of time after your tooth is removed, the bone quality and the bone quantity keeps reducing. So age is not a factor. We have people who are 60 or 70, so long as you have good quality of bone, you have good density of bone available, and you have no other uncontrolled medical conditions, a diabetic condition which is not controlled, or a hypertensive which is not under proper medications, or a person who is a chronic smoker. These are relative contraindications, but not the age per se. So even if you are much older, you are always a candidate for dental implants. Many times I get this question asked is, once I get my dental implant done, what changes will occur to me? Or how can I eat? Yes, dental implant, although a minor procedure, is still a surgical procedure. And so there are some post-operative instructions that you need to follow, and there are some things that you need to be aware of once you have undergone a dental implant. Number one is, it's a wound there. So your doctor, whoever has done your dental implant, you would have got a couple of stitches there. So don't fiddle around with those stitches with your tongue, and to ensure that healing occurs uneventfully, go back after a week to get your sutures removed. Number two is, avoid eating anything hot or spicy. As you know, it's a wound, so there is a chance that it may cause some sort of a burning sensation when you eat anything hot or spicy in the first few days after surgery. Number three, do not consume alcohol or do not smoke as the initial healing around an implant gets affected. Alcohol, as we know, dehydrates your mucosa, and smoking reduces your blood supply to that area. So the microenvironment in which the healing is occurring is going to get affected if you smoke or if you drink. Take your medications as prescribed. A lot of times we think, patients think that I'm fine, I don't have much pain, so why do I need to take a painkiller? Because sometimes we have to give you a medication that is both analgesic as well as an anti-inflammatory. So for conditions and for reasons which beyond what you know, if an antibiotic is prescribed or an anti-inflammatory is prescribed, make sure you take your medications for the prescribed time without fail. And finally, avoid eating anything hard on that side, because you don't want anything to interfere in the healing, because the implant placement is the first step towards getting you a proper crown. And the proper crown will come to you after 3 to 4 months. So till such a time, even if there is a temporary that your dentist gives you, keep in mind is like hati ke daat, it is mainly only for aesthetics, but not for function. So take care of that surgical side. Do not overload the temporary that is being given to you. Keep that area clean and follow all the instructions to ensure that you have a successful dental implant treatment. I get asked this question many times. Is my mother or my father or myself, I'm losing almost all my teeth, right? And I don't want to wear a regular denture, because regular denture can cause you a lot of problems. The inability to eat, inability to keep that denture clean, or the point that it doesn't stay, it's not very stable in the mouth, and it can affect your smile, it affects your confidence. But I'm old. Can I be a candidate for a full mouth dental implants? Yes. And if you fall under the normal parameters, which include your blood parameters and your sugar and your diabetic conditions are all under control, then yes, and your bone quality and quantity is good enough, then definitely full mouth implants is possible. And nowadays they are minimally invasive and they are quite fast, that we can get your implants done within about an hour's time. The process of doing the full mouth rehabilitation with implants will involve the placement of somewhere between 4 and 6 implants in each arch, in the upper and in the lower, and then we'll be fabricating the denture on the same day, so that the day that the implant is placed, you'll go back with teeth. And then we wait for a period of up to 3 months, and once the implants have completely healed up, which we call it as osseointegrated, we will remove the temporaries and give you your permanent tooth, which can be either a ceramic one or it can be an acrylic one, depending upon the number of implants that have been placed for you initially. But yes, full mouth implants is now a reality, and it is much lesser invasive and a more opted for choice among patients. This is also a question that is commonly encountered by us. Not everything is hunky-dory about dental implants, and once you get a dental implant, it's nothing that, you are set for life. In fact, dental implant failures do occur. Dental implant failures can occur immediately after implant placement, which could be something wrong with the surgical site or an infection in the surgical site. Dental implants can fail after 6 months of placement, which could be either due to osseointegration failures, that means your implants have not taken up completely within your bone, or it can occur even much later in life, about a year or 2 years or 3 years after implant. So failures of a dental implant can occur at any time. One thing that I always tell patients is that, when you have a natural tooth, you have natural cells that are available in that area and that help you fight this infection. Whereas a dental implant is a foreign body, and so there are no natural cells available around the implant to help you fight that infection. So if at all you get an infection around your dental implant, like you get, or around a natural tooth, the rate at which the infection progresses is much faster around a dental implant than it is with a tooth. So what is it that you need to do? All these days, even if you have not been to a dentist regularly every 6 months for a checkup, it's still okay. But once you've gotten a dental implant, you have to make that lifestyle change, and you have to ensure that once in 6 months you have to go and get your implant serviced, get your teeth cleaned. An annual X-ray is necessary to ensure that there is no further infection or bone loss that is occurring around your dental implant. Your sugar levels, if you are a diabetic, then you have to ensure that parameters are well controlled, because these can all contribute to implant failure. So these are some of the things that is necessary as patients for you to know before you take the decision on whether you go in for a dental implant or not. And always choose a dental implantologist who has the experience of both success and failure, so that they can tell you what is right for you, on whether you are the right candidate for a dental implant. This is a question that I get asked very often. Why are dental implants so expensive? And the answer is yes, dental implants are expensive. There are multiple reasons why dental implants are expensive. Firstly, dental implants are made out of titanium, and titanium is expensive. And of course, there are different grades of titanium that are available. So you have implant companies that are a little more economical, and you have certain implant companies that are a little bit more expensive. I'm going to give you a comparison of a Maruti and a Mercedes. But the question is that when you look at dental implants, you place dental implants into the bone and you wait for a period of 3 months, and you wait for these 3 months so that your implant heals. Now you give me a perfectly beautiful piece of bone, right? And the bone is absolutely healthy. Then it doesn't make difference whether I place an implant A, B, C or D, they're all going to heal beautifully. But in reality, the clinical situation that we encounter when we see patients on a daily basis is vastly different. There are patients with deficient bone, and the deficiency in bone can be in quantity or it can be qualitatively different. So depending upon how long that area has been without a tooth, patient's medical conditions and so many other factors, there are different qualities and quantities of bone that we see clinically. Right? So there are implants that are available with vastly different engineering that goes into it, where the contact between the implant surface and the bone surface can go up to 6 times greater with engineering. So implants today are available in different types of engineered surfaces. It could be coated surfaces, non-coated surfaces, sandblasted surfaces, etched surfaces, polished collars and non-collars. So these are different systems that are available based on what we see clinically. And so there are companies that will manufacture these implants, and we choose the implants that is based on what the clinical situation is. Now, yes, an experience of an implantologist is extremely critical, because an experienced implantologist who has seen both success and failures will know what kind of implant, what engineered implant surface is right for you, and based on your age, based on your function that you expect to derive, and the implantologist will choose the implant that is customized for you. So sometimes, yes, these implants can work out expensive. There are things I always tell my patients. Many times I tell them that you'd never have to beg, borrow or steal for an implant. Right? So if finance is an issue for you, there are obviously alternative treatments available, and they are not as equally good, but yes, as a temporary fix, you can do something till you get yourself ready for a dental implant. But if you have the money for a dental implant, and if you are of the mindset that, why should I spend so much money just because it's a dental implant, please rethink your choice, because today the best possible method or treatment that is available for replacement of missing teeth is dental implant. So close your eyes and just trust your implantologist and choose your implantologist wisely. But yes, once you have chosen them, then trust them, and that's the best possible thing that can happen for you. Like for me, if I have to get a missing tooth replaced or a whole mouth replaced, hands down, I would definitely think about a dental implant and choose an implant over anything else that is being offered to me.